The name of this slide is called Breastfeeding Support. My name is Raymonda Adams. I'm a certified lactation counselor and a doula, and this presentation is being brought to you by the UB Maternal and Child Health Program. What we'll discuss today is finding support and information, baby cafes, La Leche League, and the Glow Baby app. Now I will close my window out so that you can focus on the slides. Finding and support and information. Many moms will need help with breastfeeding. Some places you can find help are health professionals like your doctor or nurse, WIC, which is the Women, Infant, and Children's Program, family members, peer support groups, friends who have breastfed or are breastfeeding are a great source for information and support. Some of the professionals who can help you are IBCLCs, International Board Certified Lactation Consultants. They have the highest level of breastfeeding skill and knowledge. They have an educational background in medicine or health-related topics. They have breastfeeding specific education, clinical experience, and pass rigorous exams. They can also help with a wide range of concerns. You can find IBCLCs near you at www.ilca.org. Certified lactation counselors or certified breastfeeding educators have specialized breastfeeding training. They can teach you all about breastfeeding and help with basic breastfeeding challenges and questions. Another professional who can help are doulas. Doulas are trained to give families support from pregnancy all the way to a few weeks after birth. They are trained in breastfeeding and can help you and your baby learn to breastfeed. You can find a doula here at www.dona.org. So what does a doula do you ask? Let's find out.
What I've learned over the years is that, especially my patients who want to do it without intervention, they need to have help. Whether that's a person in their lives, or if they can afford it, a trained professional, a doula. To me, that actually is almost more important than anything else for a person who wants to have a natural childbirth.
Labor is going to be the most challenging thing a woman experiences, and typically, when it comes to feeling supported, women need to be with another woman who has seen this work.
Doulas are not something new. They're really ancient. We see all throughout history and birth art that women always had women with them at birth.
And many animals actually have helpers to help them feel private and safe and unobserved during the labour process. For example, an elephant. A labouring elephant will be surrounded by a circle of female helpers who soothe her with their trunks and sway in time with the labouring elephant, and obviously form a formidable barrier to any predator. So that labouring female in the middle of that circle feels very safe. But she also feels private because they're familiar, they're part of her social circle. She knows that they have no malintent towards her. So taking in familiar people into hospital to be your circle of elephants is very useful as well. And I particularly recommend a doula. Taking in someone who's familiar with that environment, who's comfortable with that environment, who you've got to know during your pregnancy. Very important that you feel emotionally safe with them, and who can guard your emotional well-being in labour. I think that's really the key.
Having another woman to be there and hold us, and to put a cold cloth on our face, and to tell us we look beautiful even though we might not, to massage our feet, to rub our hands, allows us to really feel that we're doing a good job.
Doctors John Kennel and Marshall Klaus wrote a book where they put down all of the research that they had done in 6 different medical centers, showing that the presence of a doula, that's literally a woman standing by, continuous labor support, decreased the cesarean section rate by 50%, and it also speeded up labor significantly, so that the average first pregnancy labor was 6 to 8 hours, just from having a supportive person standing by, loving a woman or mothering the mother.
A doula is a caretaker of the mother. And in studies of over 5,000 women involving comparisons of outcome with and without doula support, this was our finding. There's a 25% drop in length of labor, a 40% drop in the amount of augmentation with oxytocin, a 30% drop in pain medicines, a 40% drop in forceps, and in one study we noted a 60% drop in requests for epidurals.
They offer me a chance to know that I have other people who are going to help support this woman during this amazing, amazing time. And the wisdom that is offered by people who see births by lots of other physicians and midwives can be really invaluable. You know, after residency, we don't deliver babies with each other anymore. And so a doula who may have seen births by 20 or 30 other providers can offer little tidbits of wisdom that we stopped learning once we left residency.
Even if a woman's got a great partner and they have such a healthy relationship, when it comes down to this particular moment in time, men need support too. Especially when you're going to a hospital environment when so much is foreign.
Some guys are right in there and some guys are kind of like need to hang back. I think to ask somebody who's never participated in this before to be the only support is a lot to ask.
We have done studies with male partners and we know their value, but we actually have seen that with a male partner there is not a shorter, easier labor, but even with a male partner, the minute we add a doula, we get many more benefits. So there is ancient wisdom in this women-to-women companionship during labor and birth.
So the data is in, it's cost effective, it's medically proven, and as Dr. Kennel said, if it were a drug, it would be unethical not to use it.
Let's talk about the WIC program. WIC means Women, Infants, and Children. It's a program created by the U.S. Department of Agriculture. They offer food, counseling, and health services. Many offices have their own IBCLCs or CLCs on staff. WIC offers breast pumps and enhanced food packages, and mothers that breastfeed can also stay with WIC longer than those who don't. Friends and family. Breastfeeding is a way of life, and you'll need all the support that you can get. Talk to fathers, family members, or close friends about how they can help you. They can all benefit from you breastfeeding too. For many people, sitting next to a breastfeeding mother is a loving and very relaxing experience. How can your friends and family help you along your breastfeeding journey? Make sure that they're kind and encouraging. They can also help with changing the baby. They can help the mother get the baby ready to be fed. They should show appreciation for all the work breastfeeding really does take. They should be good listeners and be able to help around the house. They can play with the baby so mom can rest. And they can also entertain older children so mom can focus on feeding.